Hi, this is Dr. Donald Pelto. I want to go over today about gout. Gout's a condition that's very common in the foot, and many people come into the office with gout. And the reason I chose the big toe joint is because 9 times out of 10, when someone comes into the office with a painful, red hot, swollen big toe joint, it's gout. It can occasionally be in other toes, it can occasionally be in the ankle joint, but by far the largest portion of patients that come into the office have it around the big toe joint, kind of like this. When you're treating gout, many people know they've had gout in the past, or some people don't even know what they have going on and they need help. So let's first examine what gout is not. Gout is not someone that has like turf toe. So if you jam your toe and you get a red hot swollen joint because of that jamming or some type of a trauma, that's usually not gout, unless, for example, you may jam it just by circumstance. For example, there was a patient recently that liked to play soccer and he jammed his toe and then he developed gout. I think the gout would have happened no matter what, but sometimes that jamming may insinuate some of the pain that they're having. Also, someone that has a sesamoid fracture. So, for example, these little bones that are underneath the big toe joint, called the sesamoids. Sesamoids, they can be painful right down here. Usually they're not red. So usually they may be swollen. Same with this turf toe. You could have pain, you could have swelling, but usually it's not red. Another thing that it usually isn't a bunion. So a bunion is a bump on the side that gets a little bit red. It's usually not that swollen, may be painful, so that's usually not gout, and that's a bunion. And also something called hallux limitus, and that's where you look at the joint, it's very, very thickened, it's kind of has reduced movement in the area. That's usually not gout. So a gout is usually a red hot swollen joint that has been there for either usually days or weeks, and because of the increased uric acid, it deposits these little crystals inside of the joint. And one of the most common joints is the big toe joint, because it's kind of a cooler area and they kind of deposit in there. So how do you make the diagnosis? You can try to get an x-ray. Sometimes the x-ray, if it's been kind of advanced a little bit, you can see some eating out. You can see here, see this bone? This is a normal cortex right here, cortex along the bone. And if you notice right here, it has a little portion that's kind of goes inward. Do you see that? And that's what we call kind of a rat eating appearance of the bone. So the actual gout can erode into the bone and kind of go into the bone. It usually preserves the joint surface and it goes right around the joint. Also, if you look at it, it's going to be swollen, it's going to be red, and it's going to be hot. And sometimes if you get a uric acid level, you may find that it's elevated. But a lot of times, let's say it's elevated, it hurts the most here, and someone comes to your office right here, and when you get the uric acid level, it's already back down to normal. So that's one of the drawbacks of getting a uric acid, which is a blood test. It may be falsely kind of lower. And basically, if it looks like it's gout, and if it's not broken, we'll tend to treat it as gout. And how do you treat it? Usually my first line of defense, if someone can tolerate it, would be to put a little cortisone in here. So if you put cortisone right in the joint, I know it sounds like it hurts because it does hurt, but it really, really, really reduces the pain for people. And that'll make it feel great, reduce the inflammation, and helps people out. Here's a Medrol dose pack. You can see here day 1 and then day 2, day 3. And so it's the number of these pills that you take at one time, and you kind of taper down the prednisone. So prednisone really, really helps reduce the inflammation. Motrin, ibuprofen, Aleve may help, or other types of anti-inflammatories that your doctor may want to give you. And then being in some type of maybe a boot or even a shoe that doesn't irritate the area can really, really help, because anything that rubs the area is going to irritate it. So those are some of the treatments. There is also some other types of medications that your doctor may want you to be on, like allopurinol, like colchicine, Colchris, all these new ones. They are helpful, and a lot of times the primary care or a rheumatologist or someone may put you on them, and some are used kind of maintenance to help reduce the uric acid levels if there's a kind of a chronic problem. And you also have to talk to your doctor to figure out what's the problem. Why is it elevated? Is it something you're eating? Is it something else going on in your body? And I always tell people, treating gout tends to take longer than anyone thinks. So you think that you're going to get a cortisone, it'll be better. Sometimes it's not better that first week, maybe week 2, maybe week 3. It may take some time. And the reason is there's these crystals. Let me show you here. These crystals that kind of get into the joint. It may not be this bad, like where it's popping out of the joint, but these crystals can be painful, and they can kind of sit in there, and they need to kind of reabsorb or get settled into that joint region. And that kind of is what erodes some of the bone in there. And then if it gets really bad, we have to go in there and remove these crystals, and even sometimes remove some bone. And then you're having to deal with the arthritis and the pain afterwards with that. So I hope this was a nice general overview. If you want to learn more at the end of this video, I'm going to put a little link up top to some patient handouts that you can look at that we have in the office about gout and how to treat it and different types of things about the purine diet and everything like that. Okay, thank you. Have a great day.